Snowboard cross is a winter sport that was introduced to the Olympics in 2006. The sport involves 4 to 6 snowboarders racing head-to-head down a course of obstacles to the finish. Athletes can reach speeds of up to 60 miles per hour and complete jumps of up to 100 feet in length, often side by side. As can be imagined, this extreme sport predisposes its athletes to injury. A few research studies have shown that of the 5 major disciplines of snowboarding, border cross is the most dangerous, resulting in the highest number of serious injuries and the most days missed secondary to injury. Given the high rate of injury among this population, we endeavored to evaluate trends in ACL injury and recovery. Of those surveyed, most competed at the highest level, i.e. the World Cup and the Olympics. 50% of athletes had suffered an ACL tear during their career. 90% of tears occurred in their front leg and while landing from an airborne feature. A majority had concomitant injuries as detailed in this slide with the other data. Relatively little research has been done on ACL tears in elite snowboarders. A few articles have speculated that the position of the feet and knee in snowboarders may be a contributing factor. Eccentric quadriceps contraction produces significant anterior tibial translation and internal rotation of the knee, resulting in strain of the ACL. This max ACL strain during dynamic jump landing occurs when the knee goes from a flexed to a semi-extended position in anticipation of landing. As noted, our study showed that 90% of ACL tears occurred when landing. The picture on the slide demonstrates the progression of body position throughout a jump. One of the largest barriers to speed in border cross is wind resistance. Therefore, riders must attempt a maximally aerodynamic position of flexed hip and knees, aka a tuck, at all times to minimize resistance over the minute-long race. After takeoff, by mid-air, the athlete should have recovered and assumed the tucked position. In anticipation of landing, the rider will extend their hips and knees in an attempt to softly land their board on snow, as seen by the rider in the red bib. This is the semi-extended position, which puts the ACL at maximal strain upon quadriceps loading. Additionally, studies have shown that injuries in border cross occur more commonly when riders race head-to-head rather than individually riding the course. This could be a result of situational awareness, as athletes know in real time whether they will be eliminated and taking greater risks in order to advance. These factors, among others, put professional border cross racers at increased risk of ACL tear.